My name is Caesar. And I'm going to be doing NGtube insertion and removal, ostomy care, removal, and applying a new ostomy bag. Okay, so for all these procedures, you want to make sure you do your pre-procedures, which is checking the PCP orders with the patient care plan. You want to make sure you gather all your supplies. You go into your patient's room, provide for privacy, perform hand hygiene, maintain standard precautions. Identify the patient using 2 patient identifiers and introduce yourself. My name is Caesar. I'm blah 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 blah. And then you also want to make sure you assess for any allergies or due to latex, tape, all that good stuff. And make sure you have the bed at a comfortable working positions for you. So for NG2 insertion, go in your patient's room, privacy, hand hygiene, identifiers, all that good stuff. So once you go in your patient's room, you want to make sure you put the bed up, set the patient in a high Fowler's position. If they're able to tolerate it, or if there's if there's no contradictions, make sure they're sitting up. You then want to assess your patient's cough and gag reflex. You also want to check the patient's nares. So you want to tell them to breathe in through the nares, check for patency. You also want to use a pen light to check inside your patient's nostrils. You want to make sure there's no lesions, no blood, no discharge. You want to make sure there's no previous surgery or injuries to that nose. You want to make sure you use a nostril that's best suited. You also want to make sure when you have your bedside set up, you want to make sure your dominant hand is closest to the nose. Okay, so I already did pen hygiene, all that good stuff. Apply my gloves. You then want to let your patient know that if they're uncomfortable or feel like they're gagging or can't tolerate the procedure, raise your hand or a finger up to let us know. Use a towel and place it over your patient's chest. And then if the patient is not NPO, give them some water to drink with the procedure. You also want to make sure there's tissues, a basin and stuff close to the patient. So when you first get your tube, you want to measure it from going from the tip of the nose to the earlobe and down to the xiphoid process. So for me, that would be 45. Some of these tubes are already pre-marked, so you want to make sure you document that. If it's not pre-marked, get a permanent marker or a piece of tape and fold it there or mark it with the marker. Document that as well so your nurse can know how to look for it. Okay. Before inserting the tube or taking it out, you want to make sure you have tape ready. So you want to cut about 4 inches long and then about 2 inches down the middle, forming some little pants. That's going to be applied on the patient's nose to secure the tube. Another piece of tape, just in case. Okay, now that you have your tube and all that, try to keep it as clean as possible because this is going into the patient's nose down to the stomach. You want to lubricate about 4 inches of the tube. You want to tell your patient to hyperflex their neck, so kind of have their neck like that. When you go in there, make sure you don't force it. If you feel pressure against you, try the other nostril if you're able to. If not, remove it and try again, but you don't want to ever force the tube in there. You also want to go quickly and as smoothly as possible and be gentle if you can. So you want to start inserting the tube. Once it reaches the nasal pharynx, tell your patient to put their chin down. They could drink water go help by swallowing, so the tube could go down smoother. Have your patient breathe in through the nose. Not the nose, sorry, their mouth. Started to number 45. There it goes. You want to apply the tape, put it on the bridge of the nose with little cuts at the bottom. And then to secure the tape, just wrap it around the tube, making sure you don't block the nostrils. You also want to be careful because these tubes do slip out really easily, so you could have somebody help you or just keep on holding the tube till the tape is placed. You could tug at it gently. It's not going to come out. Nice. Make sure the tube is clamped. You also want to secure this tube to the patient's gown. You can use a piece of tape, kind of fold it. And you could probably apply a pin here. Make sure you don't put the pin on the tube or in the tube, common sense. Apply this to the patient's gown, not the skin. remove the towel. Okay, and then put the bed at the lowest position. Hand on the call light. Before doing anything, you want to make sure that you verify the placement on the tube using an X-ray. It is the proper way and the only way to really, check for accuracy. You could also use a pH test to do it, but you want to make sure you do that after radiology has confirmed that it is in placement. And then after all that's done, same thing, pre-procedures or post-procedure, you want to put the bed at the lowest position, call light within reach. You want to let your patient, ask your patient if they need anything when you will be coming back. Clean any equipment that came in contact with the patient, or dispose of the equipment if you need to. Remove gloves. Let me just pretend I removed them. Hand hygiene, all that good stuff. And then you want to document the time, the date, assessment, the procedure, and how well the patient tolerated the procedure. You make sure everything's documented. And that's that for that. Okay, so for NG2 removal, same thing, pre-procedure, check PCP orders with patient care plan, gather supplies, go in the patient's room, hand hygiene, all that good stuff, patient identifiers, allergies, all that stuff. So for NG2 removal, put the bed up, sit them in a high fallers position if they're able to tolerate it. Have water if they're not NPO. Same thing, have a towel, put over the patient. Chest, you want to remove. If this is going to a wash suction or a feeding pump, you want to make sure you disconnect all that stuff. If it's a feeding pump, disconnect, flush, clamp back. Perform hand hygiene, put on new gloves. Let's just pretend new gloves. Take the tape off the patient's gown. You could tell the patient to take a deep breath. Once you move the teeth, and then the tube comes out real easy. So you just kind of clamp it in your hand. Remove the tube with your gloves. Dispose of it properly, per hospital procedures or whatever your facility has you do. After removing the tube, same thing. You want to do a post-procedure. Bed lowest position, call light. Ask your patient if they need anything, when you'll be coming back. All that good stuff. Hand hygiene, another big one. Document daytime assessment, procedure, how well the patient tolerated procedure. So that's for the NG2. Okay, for ostomy care, it's my friend Teddy. You want to pre-procedure. Look at the patient, at the PCP orders with the patient care plan. If you're going to do removal, also same thing, do all that good stuff. You want to, maintain hand hygiene, standard precautions. Introduce yourself, identify your patient, assess for any allergies due to latex, tape, medicine, you're gonna, all that stuff depending on what your procedure you're gonna be doing. So once you go in your patient's room, I don't know if you guys can see that. Okay, so for ostomy care, I'm sorry. Ooh. Okay, can't really see my face, but that's okay. When you go in the patient's room, hand hygiene, all that stuff, put on gloves. You want to grab a towel, put it here. If you're just checking the ostomy bag, you could drain it first. If there's any stool in there, you could use like a graduated cylinder. Let's just pretend this is it. Unclap it. Save this for later. Drain this in here. Or use a bedpan, or if they're able to get up to go to the toilet. If you're measuring, you want to be precise. It's better to use some sort of something with numbers on it. Okay, you could clean the edge of the thing if you're gonna still use this bag. You could check at the stoma, look around, make sure it looks good. If you're removing this, once you check the stoma, you took everything out, and you check the PCP orders, you're removing the, all that good stuff, Hand hygiene again. Once you clean this off, dump everything out, look at it, remove gloves, perform hand hygiene. Okay, put on the new set of gloves and then proceed to removing the thing. Make sure your patient is like in a supine position or semi-followers. You don't want them sitting like this. You want to make sure they're kind of flat. You want to make sure the patient's skin is taut. Kind of remove this off the patient. This kind of got stuck on there. You want to dispose of this properly, hospital policies or whatever your facility requires you to do. You know, after removing all that, I would take off my gloves, perform hand hygiene, put on a new set of gloves. You know, with the towel here, grab another like washcloth and kind of clean around the stoma. Look at the stoma, make sure it's, you know, pink moist. Make sure it's not like bluish, any discoloration that could, you know, be signs of necrosis. You want to make sure there's no like lesions or anything that, you know, shows infection. So clean around with, you know, warm water. You don't want to use any pre-moistened wipes, soaps, lotions can irritate the stoma and the skin. You could clean the stoma too by gently tapping, but be careful because, you know, it has a lot of blood vessels and it could bleed. You could put a piece of gauze if it's constantly draining stool. So once you clean all that, you know, same thing. You want to get your supplies. You know, procedure, as I had mentioned earlier, for your pre-procedure, make sure you have everything ready. You know, check patient identifiers, allergies, introduce yourself, privacy, all that good stuff is going to be for every single thing you do. So I have my little measuring device here, you know. So once I clean the stoma, all that good stuff, remove gloves, hand hygiene, put on new gloves because, you know, you were touching the stoma, you could have gotten stool on your hands. Grab your measuring device. Mine's a little ghetto. Oops, sorry. It kind of, okay, so once you measure and you show which one is preferred, so for this one, for me, it would be, you know, this one. Make sure, can't really tell, but make sure it has 1/8, about 1/8 of free room. You don't want to make it too small because that could, you know, cause pressure on the stoma and cut off blood circulation. You don't want to make it too big because it could start draining and cause all kinds of issues. So the best way to measure is make sure it's about 1/8, you know, width. You then, you know, take your new stoma off. So after measuring the stoma and all that good stuff, you know, same thing. I was touching the stoma, so I would take off my gloves, hand hygiene, put on a new set of gloves, and get ready to apply the new ostomy bag. So start cutting. And try to make sure you have, you know, a decent pair of scissors, because some of these scissors you could cut ugly and it could cause a lot of sharp edges. And I mean, you don't want, the stoma is pretty sensitive, so you don't want sharp stuff. So once my stoma's cut, kind of clean the edges around. You know, make sure it's nice and smooth, there's nothing on there. Nice, alright. When you apply this, put it right over the stoma. Apply light pressure. Some of these come in one piece. So, but this one's a 2-piece ostomy bag, so you have to do this first. And of course, when you're doing this, make sure you take the gauze off. You don't want any gauze stuck under there after you just applied it. Okay, nice. Okay. And then you want to get your bag, your ostomy bag, which is, you know, right here. You want to clip it into place. You also want to get a patient's input if able to. You want to ask your patient if they want to line like this in case they want to go for a walk or they want it to the side. Some patients, you know, they prefer to have it a certain way. When you do all this, when you change an ostomy bag, you also want to make sure you don't do it after a meal or right before a meal. Because, you know, some patients, they might, you know, get disgusted by that or it might make them not want to eat their meal. So make sure it's done in between meals or before a meal, but not right before a meal or, you know, right after a meal. Okay. And then when you close this, you just want to apply this little clamp. Turn it once. There we go. You could apply slight pressure, put your hand over, or let the patient hold it for a little bit. Let that heat kind of, you know, help with the adhesive to get stuck on there. Okay, you could tug at it gently. Okay, there you go. So after doing the ostomy bag, you know, clean up your area, all that good stuff. And then, you know, pre-procedure again. Or not pre-procedure, post-procedure again. Sorry, I get those words confused. Post-procedure again. You know, put your bed to the lowest position. Make sure the collar is within reach. You know, remove your gloves. Perform hand hygiene. Just removing right now. Remove your gloves, perform hand hygiene. Clean any equipment that came in contact with the patient, or dispose of it if however your facility does it. You want to let your patient know that you're going to be coming back later, and if they need anything at the time, you know, let them know, I'll be back in 30 minutes, all that good stuff. Hand hygiene, I already mentioned that. And then make sure you document the time, the date, you know, the assessment, you know, like the stoma that you assess, everything, you know, how everything looks. You make sure you document the procedure, you know, what you did, maybe what you used, you know, like some procedures they require to put if you put gauze, or, you know, this or that. And then you also want to put how well the patient tolerated, just in case for next time you have to do it, or somebody else has to change the ostomy bag or NGtube insertion. They have an idea of how the patient reacted, and that's it.